Hi, my name is Katrina, and I'm going to be answering 4 questions regarding privacy and security. Question 1. Explain the difference between privacy and security in the EHR. Privacy refers to a patient's right to their health information. It permits patients to do what they want with their health information. For example, who can access it and who can share the information. Security, on the other hand, refers to the interventions and measures used to protect the information. Question 2. Explain what information is protected by HIPAA and briefly summarize the HIPAA privacy rule. Provide 2 examples of common HIPAA privacy violations and how they would be avoided. HIPAA is a federal law that protects the privacy of protected health information. This can include patient's name, date of birth, addresses, social security number, medical record number, etc. HIPAA's privacy rule protects patients' privacy by regulating how covered entities disclose protected health information. Common examples of common HIPAA privacy violations can actually be seen in this assignment. In one instance, 2 healthcare workers were discussing a patient's test results, saying that they needed to report it to the CDC. Although they remained professional, another patient heard their conversation and asked about it. This could have been avoided by simply discussing the results in a private and secure location, where unauthorized entities will not be able to observe the conversation. In another instance, a nurse decided to view her friend's chart, although she was not the friend's nurse. This could have been avoided by training the staff on cybersecurity awareness and HIPAA compliance. Implementing safeguards and regular audits would also be useful in this situation. Question 3. Briefly summarize the HIPAA security rule and provide an example of 2 safety measures that could be put into place to ensure the security control of patient information. HIPAA security rule protects electronic protected health information by mandating covered entities to utilize safeguards. 2 examples of safety measures that can be placed to ensure security control is surveillance cameras and biometrics like fingerprint or facial identification. These are both examples of physical safeguards. Question 4. Explain and provide an example of when it would be appropriate to share patient health information without written consent. According to HIPAA's privacy rule, covered entities are mandated to report notifiable diseases to the CDC for public health purposes. Prior consent from the patient is not needed, and the purpose of this is so that they can track, trend, and prevent potential outbreaks. Thank you.